I want to thank the Knowledge Transfer Network for inviting me to talk to you today. This sort of interdisciplinary dialogue is essential if we're to see developments in the world of surface engineering and additive manufacturing. My name's Andrew Dawood. I'm a dentist working together with my partner, Dr Susan Tanner, at the Dawood and Tanner Specialist Dental Practice. In addition to our dental practice, we're engaged with medical and dental 3D imaging with Cavendish Imaging, our specialist imaging practice, with craniofacial implant manufacturer, with Cavendish Implants, and in 3D printing and industrial design for the design, art and manufacturing world with Digits2Widgets, our 3D printing studios. Our recent involvement with the Material and Design Exchange and KTN saw the first ceramic workshop on additive manufacturing hosted at our state-of-the-art 3D printing studios in Camden earlier in the year. This brought together different industrial sectors that engage with ceramic manufacturing, including traditional tableware, dentistry, and orthopedics. We had a good balance of academics and industrial players, and we all had much to learn from each other. I would like to present our own unique outlook on technology in dentistry and in surgery and the use of 3D printing to give you a sense of why we might be excited about the additive manufacturing of ceramic structures. In our various activities, our team of scientists and technologists work with a number of extraordinary and quite indiscriminate machines, working across these strangely different yet entirely interconnected disciplines. Rather like your home computer setup, the three fundamental technologies that we use in our rapidly evolving 3D world are 3D scanners, X-ray scanners, which allow us to digitize physical objects like patients, computer-aided design software that allows us to interact with the object on screen, and 3D printers that are able to actually physically manufacture new objects in a variety of materials. But thus far, additive manufacturing in ceramics is not really an option. In our work, we move from our physical world to the virtual, and then back to the physical again, creating objects, if not from thin air, then from fine dust. We use this technology in everything from art and design to architecture and jewelry making. From my own perspective, dentistry is where I started in the 90s, because this technology particularly lends itself to dentistry, and I'll explain why. Mass production does not need 3D printing. If you're going to make the same thing again and again, then there are many established industrial technologies that will allow you to do this cheaply and effectively, and probably overseas. In dentistry, however, every time we treat a patient with implants or prepare teeth for crown and bridge work, what we do for that patient is entirely unique. We scan a tooth, a jaw, a patient, and bring this unique digital design into our own virtual world. This is personalized medicine. There is so much hype about 3D printing at the moment. But in dentistry, in a variety of forms, 3D manufacturing technology is common, and it has been for years. We use it to make the humblest crown or implant component. We can mill from a block of titanium or tooth-colored zirconium, and we can print an elaborate bridge superstructure layer by layer from a pure metal dust, but we can't yet print in ceramic materials. Using 3D printing, our particular approach to surgery has allowed us to immediately reconstruct patients who've lost large portions of their jaw as a result of cancer or even gunshot injuries, with pre-planned and predictable placement of grafts of bones transferred from other parts of the body, with simultaneous placement of implants and prosthetic teeth. Again, we can cut and carve bone, but as yet, printing ceramic tissue scaffolds to facilitate the process is not an option. Our technological approach already leads to shorter, more predictable and less invasive treatments, and a much improved quality of life for our patients. There's the potential to also dramatically reduce costs, but this is intellectually challenging for hospital managers in the health service and for those who find it difficult to accept new high-tech workflows. The real beneficiaries of this approach are our day-to-day patients. Our experience with extreme cases enables us to make straightforward treatment even more straightforward, and for many patients, to make what was once considered to be impossible, possible. Similar design and production technology also allows us to make implants to repair the skull or the eye socket after injury or cancer surgery, using implantable polymers or 3D printed titanium. We're also keen proponents of 3D technology in orthopedics. 3D printing in ceramic materials will add tremendously to our armamentarium, allowing us to directly build objects as diverse as dental restorations, tissue scaffolds, and domestic tableware, which as a keen potter is also tremendously interesting to me. I maintain that 3D printing should not be seen as a new way to make old objects, but as a new way to make entirely new objects that simply could not be made any other way, and in medicine to carry out new treatments to the great benefit of our patients. To learn more about how Dawood and Tanner have been pioneering 3D printing in dentistry and in dental implant treatment since 1999, do visit our website, www.dawoodandtanner.com.